We want to welcome everyone and good afternoon, of course. It's our briefing for January the 26th, 2021. We're joined by Kelly Colopy, our health director, who will be giving us an update as she always does. But I wanted to go over just some general stats as well, so people know how we're doing. First, folks should know that we've given almost 36,000 doses of vaccine across Long Beach. Just a week ago, we were at about 21,000. So you can see that our vaccine doses here in Long Beach increased by 70% in just a week. You've probably been hearing about our vaccination program. Obviously, this is a huge challenge across the state. But I can confidently say that I think we have one of the best vaccination programs of any city or health jurisdiction in the state of California. And it's not that we don't have challenges or issues that come up, because we do. But our health department team have done a just phenomenal job of setting up this system. So we're very, very grateful. We also, of course, know that we are well into that first category of folks. In the B category, we have gone through a vast majority of our healthcare workers in our hospitals and clinics and pharmacists, and now, of course, are in that 1B category, or that first B category, which includes 65 and over, and includes teachers and educators, and food and grocery workers. So all of those folks are in that first category. And I want to just note, I've had some questions about within that category, is the state prioritize folks within that group? Just to be clear, because I think some folks have some questions. That category, the 65 and over, educators and teachers, food, grocery, emergency workers, are not prioritized by the state. Within that category, they're all in that same category. But in Long Beach, we are trying the best we can to prioritize the 65 plus as a critical group. So we just want to make sure people know that. I've got a lot of questions about prioritization. The state puts them all together in one group. We are prioritizing as best we can 65 and over, but while also doing everyone else. Want to also know that we all know that we opened up our convention center, which has gone really well. We, on that very first day, did about 1,800 folks, continue to do more folks. And now throughout this week, we're doing anywhere between 500 and 600 a day, mostly educators this week. We're also doing food workers at the end of the week. We'd love to do more, and people ask, why aren't we open 24 hours a day or doing more? The truth is we're doing as much as we have vaccine available. So if we had more vaccine, we'd be doing more, a lot more of the vaccination. So we have the capacity to be doing 5-6 times what we're doing right now. And as soon as the vaccine comes in, we'll be able to do more of that. Also want to just note that, how are we doing as we break these numbers down? Older adults continue to move forward. We've been doing older adults almost every day since that first day we started, regardless of what's happening at the convention center. And so that's been really positive. We do 65 and over consistently at the Long Beach Health Department. And I want to just let folks know that we've also just launched a new partnership with Memorial Care. And so at Memorial Medical Center, we have a second clinic going where they are also doing a few hundred of our seniors from our list at the hospital. And so some folks may have noticed, I didn't get sent to the Long Beach Health Department. I did not get sent to the convention center. I got sent to Memorial Hospital. That's because they're getting through some of that vaccine as well. And so it allows us to do more. They're doing 500 older adults for us this week, and continue to give us opportunities to get more of that 65 and over population in. And so they're using our vaccine supply, but doing the vaccines for us. So we thank you to Memorial, and they've been a great partner. And as a reminder, the way to get a vaccine in Long Beach is to sign up for VaxLB. So when you got to go to longbeach.gov to the vaccination page, put all your information into VaxLB. We know exactly how many 65 plus seniors we need to get to, how many teachers we need to get to, how many food workers we need to get to, and the health department is triaging all of that and getting people placed into appointments. The health department will then notify you or email you when you can go make an appointment. So please, again, you don't have to even check VaxLB every day. Once you put your email in, we're going to notify you. So that's the key thing. And of course, if you don't have internet access, we'll help you if you call 570-INFO. We'll also note that yesterday we began vaccinating educators. We did Long Beach Unified School District. We're doing Long Beach City College. Most of them are tomorrow. And throughout the week, we're doing some of our private schools. We have pre-K schools, early childhood ed educators are all happening across this week. We, of course, would love a lot more vaccine to do a lot more of our educators faster, but we're doing what we can for what we're being sent by the state. And we began vaccinating food sector workers some last week, throughout this week, and on Friday of this week, we're doing a pretty large clinic at the convention center where we are vaccinating a lot of grocery store workers, a lot of folks from kind of Vaughn's and Trader Joe's of the world, and some of the bigger markets are coming in and being scheduled as well. We also have a partnership with both Vaughn's and Ralph's. Correct me if I get those wrong, Kelly, I think those are the two, right? Where they are helping us do vaccinations to a lot of their employees as well. And so that's happening across the city. Let me add that a little bit about second doses. Once we get through this week, in February, our priority has got to go back and shift back to second doses for all the folks that have received their first dose already. A lot of people don't realize, people say, why is this process so slow? Once you get to second doses, it slows down new doses. You've got to do second doses and then start layering new dose people on top of that. So the priority for Moderna and Pfizer will be second doses. We've also had some questions about when those shots should take place and how they get them. As a reminder, you don't need to schedule your second appointment. If you got your shot from the health department, we will send you and notify you when your appointment is. We have your information. If you got your shot from a hospital, they will notify you. If you got your shot at a pharmacy, they will notify you. You've got to get your shot at the location that you got your first shot or through the same partner system. And the CDC has also adjusted some of its timeline. The CDC now, and Kelly can speak to this more if there's questions on this, there is no exact date you need to get your shot per the CDC. It used to, your card might have a certain date on it. The CDC is recommending that as long as you get your shot within 2 weeks of that, after that date, it's 2 weeks after that date, then the effectiveness ratio stays exactly the same as if you were to get your shot that same day. And I think Kelly can clarify that. She knows more about that than I do as a health person, but that's something that the federal government is communicating to states, and now states are communicating to us. But of course, we want to get you your second dose as close to your date as possible. So we're working on that, and we hope to have that moving along pretty efficiently. And then I also just want to let folks know that, of course, we have the governor announce some significant changes yesterday to our stay-at-home orders. I think we're all aware of those already. To kind of put that all together, we know that hospitalizations in Long Beach have started to come down. ICU capacity has gone up. This has been reflected all up and down the state. And so for us in Long Beach, starting today, patio dining has reopened with additional restrictions on how spacing on tables and wearing masks. Hopefully the entire time folks are not actually eating, but if you're sitting down, please continue to wear your mask if you can. And we've also put in place some additional restrictions and advice for nail salons and barbershops and personal care that can also reopen. So for all those businesses, we just wish you, obviously, first the best of luck. We're grateful to you and how hard it's been, but we also want to keep each other safe and follow the actual best practices possible. And to people in the community, COVID is incredibly serious still. We're losing lives still every day. And we are also in a position now as a city where we are at 600 folks that we have lost, almost 600 folks we have lost. And that has happened exponentially in the weeks, as we know, prior. So we got to stay vigilant and support our hospitals. The state projects our ICUs to be in even better shape in the next week and the weeks following, and we'll continue to look out and do that work. With that, I'm going to go ahead and pass this off to Kelly Colopy, who is going to give us some more updates.
Good afternoon. Thank you, Mayor. Just real quickly, I want to clarify in terms of the number of days for the vaccine. So the CDC has said that it can now be up to 42 days, whether it's Moderna or Pfizer, which is essentially a total of 6 weeks between your first dose and your second dose, for which that you can get that. What they are also indicating is that they haven't really done more research after that 6 weeks to determine whether there's any degradation to effectiveness. So at this time, they are saying even if it's longer than 6 weeks, you wouldn't have to take a third dose or start the series over. But we are focusing right now for the city of Long Beach. We're really focusing on trying to get everybody in within their 21 and 28 days, depending on Pfizer and Moderna. But we do know, and per the CDC, that we can go up to 42 days, and everyone who has had their vaccine will continue to have the same level of effectiveness in terms of its immunity. So I just wanted to clarify that. So as of today, we've had 46,833 Long Beach residents testing positive for COVID-19. That's 10% of our population that has been through testing that is known to us that have positive cases. We have 310 people in the hospital, and as the mayor mentioned, we've lost 618 Long Beach residents to COVID-19. 22 of these were over the weekend. So on January 14th, we had crossed the 500 death mark, and then over this past weekend, 600. So these numbers are not yet slowing down. So yesterday, I just wanted to talk a little bit about the health order. So the state lifted the regional stay-at-home order. This means that counties that return to their color-coded system, which for us is purple, and that color-coded system is number per 100,000 population, as well as the positivity rate among people who have taken the COVID test. Lifting the stay-at-home order is based on projected ICU capacity, so it's looking at 4 weeks out right now, with the anticipation that we'll have more than 15% of ICU capacity available at that time when it's adjusted for COVID. Right now, our adjusted regional ICU capacity remains at 0, but the state projects that our regional ICU capacity will rise to about 33% by February 21st. They have changed the calculation somewhat, where they're now including staffed surge beds into their projections, and this has created a much more positive picture of capacity than previously. The projection is also based on 4 variables: our current estimated ICU capacity, our current community transmission, current regional case rates, and the proportion of cases admitted to the ICU. So they take all of that at the regional level still in Southern California, and with that, they're projecting 33% by the end of February. The release to purple does not mean we're out of the woods for this pandemic, so I don't want people to get super comfortable. The numbers remain much higher than they were in early December, but they're much better than they were earlier this month. So in early December, our case rate per 100,000 was 39. It hit a high of 162 in early January, and it's now back down to 86, and the chart reflects that. Our positivity rate at the beginning of December was 5.9%. It hit a high of 17%, and it's now down to 12%. So we are seeing, we've seen as our peak for those so far. We're hoping that is our peak forevermore with COVID. So I do want to remind everybody that to get out of this purple and most restrictive tier, we have to have 7 cases per 100,000 compared to the 86 that we currently have. And the positivity rate has to be less than 8%. So we do have a ways to go. So the chart that you see now shows the number of new cases reported every day. As you can see, we had a surge in the summer, and then we had a huge surge following Thanksgiving and over the holidays. Thankfully, these daily cases are beginning to decrease. We went from an average of 700 cases, over 700 cases per day earlier this month, to 320 in this past week. Our hospitalizations, the next chart, shows that our hospitalizations are also declining since January 9th. While the number of hospitalizations remain high, they are definitely decreasing. So over the past 2 weeks, the Long Beach area hospitalizations have declined from 578 to 433. And then those who are Long Beach residents went from 365 to 310, and that's in the past 2 weeks. So that's something to celebrate. The unadjusted intensive care the ICU capacity increased just recently from 9% to 11% in these hospitals as well. So today, we'll issue the revised health order lifting the restrictions based on these data and the projections for ICU capacity. This means as of today, some sectors are permitted under the purple tier to reopen. This includes, as the mayor mentioned, outdoor in-person dining. This is subject to several restrictions. The requirements will include spacing tables 8 feet apart to make sure that when people pull out their chairs, they remain 6 feet apart, requiring masking at all times except when you're eating and drinking, and strongly encouraging folks to dine only with members of their household. I want to remind people that often, that dining still remains one of the more risky behaviors, given that you are taking your mask off while you're eating and sitting close to people. So we want to make sure the more that you can eat only with your household, the better that is. Other things that are open now is indoor personal care services. This includes hair, nail salons, tanning salons, skin care, body art, and massage therapy. But there are capacity limitations to maintain that 6 feet of distance between customers and wearing masks. Hotels, motels, lodging, and shared rental units are also allowed open for both tourism and individual travel. The limited services as designed by the state are now back on, and also outdoor operations of museums, zoos, and aquariums. Limited gatherings of no more than 3 households, with gatherings allowed outdoors only, are also now allowed. The health order, which will go online later today, will give more details and provide guidance for businesses as they reopen for services allowed within the purple tier. We're eager to get back to some semblance of normality, and because we've been able to slow the spread, limited reopening of these sectors can happen. But while it expands the residents' array of options, I ask that you be thoughtful about the choices that you're making so we can prevent another stay-at-home order. Let's say, for an example, in 1 week, you go out to dinner 3 times. You have a different group of friends for each time you go out. Or you go and then you get your hair done, or the salon or a barber shop, and maybe you get a massage. And then you join 3 families outside for a weekend birthday party. Technically, each of these are allowed under the health order. But that week of activity has exposed you to many people, and you've exposed many others to yourself and those around you. So that is what the issue is about the increasing numbers that we see when we look at hospitalizations and deaths within the city. So we ask you to really continue to limit your outings and to choose carefully what you decide to engage in. On last Monday, on January 18th, the South Coast Air Quality Management District actually lifted the limits on cremations because there's been such a backlog of people due to deaths. And we want to make sure that is another public health issue. We just want to make sure everybody understands how important it is that we still remain safe. Please remember to take out. Takeout is still safer than dining on site. Dining on site with members of your household is safer than dining on site with people outside your household. When dining with others outside, it's riskier than if you take your mask off and because you're eating and drinking. So all outdoor activity is just safer than all indoor activity. So let's continue to work together under this expanded opening the purple tier allows so we can limit the spread of COVID-19. And the more cautious we are now, the more quickly we'll be able to get into the less restrictive tiers and open more broadly in the future. So with that, I think we're open for questions. Thank you.
Thank you, Kelly. We will now move on to media questions. As a reminder, we have time for 1 question each. For follow-up questions, media can reach out to the Long Beach Joint Information Center. First question comes from Kelly at the Long Beach Post. Go ahead, Kelly.
Hi, can you guys hear me?
Yes, we can.
Okay. There's been some concern with the shortage in vaccine supply that some people may not be able to get their second shot within the recommended time by the CDC, even with the expanded time. What is Long Beach doing to assure that it will have supplies for people to get their second shot?
So we, in recognizing that the first, that we would need approximately 7,000 doses within the first 2 weeks of February, we are prepared with 2,500 doses there, and then are working in conversation with the state to ensure that we receive the remaining doses. The 2 weeks that allows with under the 6 weeks is very helpful in that portion, but we are focused right now on ensuring that we have the second doses for all who need them. You want to add?
Let me add to that. And first, just to also, I want to make sure that we clarified that the time that's recommended by the CDC, Kelly, is up to 6 weeks, correct?
42 days.
Okay, because I think I said 2 weeks. I just want to clarify, it's 6 weeks, just to make sure that we're clear on that. So I want to clarify, I think what I said, I think Kelly corrected it, so thank you. Let me just go back to what Kelly said. We're going to do everything we can to make sure that we have as much vaccine coming in as possible. So this is like an all-out effort, and I think the health department's doing what they need to do. I was on the phone yesterday with the new, as they're calling her, vaccine czar in California. I've been talking to governor's staff today. We're gonna push every lever that we have and push against the state really hard to ensure we get as much vaccine as possible. Cities and jurisdictions that are doing it right should also be getting supported and rewarded for actually doing what the state's asking us to do. And so we know the vaccine supply is running down across the state. We're going to get it all in, and we feel good that we're going to be able to manage all the second doses and continuing to vaccinate other folks. But second doses will be a priority starting next week.
Thank you, Mayor. This next question is for you as well. This comes from Haley at the Press Telegram. Are you concerned about another potential surge, since previous moves to reopen more businesses have been followed by surges?
Yes, I think we're all concerned about future surges. I mean, a surge and its impact we're all consistently worried about that, I think, all the time. I think right now, the state models and the state health model projections show ICU capacity increasing in our region and in our area in Long Beach over the next few weeks. And so that's a good sign. And so if that modeling stays on course, we should see our ICU capacity actually increase over the next few weeks in Long Beach and hospitalizations decrease. So are we concerned about a surge? Of course. If people act responsibly and take care of each other, we should manage through all this. But this is a personal responsibility question. So people also have to be responsible for themselves and wear masks and not gather in enormous groups and try their best to stay within their family unit. And when they're supporting businesses, do so in a way that's responsible.
Thank you, Mayor. That concludes questions. We will now move on to Spanish interpretation.
Buenas tardes. Hoy es nuestro comunicado de prensa para el 26 de enero del 2021. Vamos a empezar con una actualización sobre nuestro lanzamiento de vacunas. Hemos hecho un trabajo increíble al sacar las vacunas rápidamente. Hasta la fecha, nuestro Departamento de Salud ha administrado 18,174 dosis de la vacuna aquí en Long Beach y se han administrado más de 35,800 dosis total de vacunas. En comparación, hace apenas una semana, el número total de dosis administrados era de solo 21,000 dosis. Hemos aumentado la cantidad de dosis de vacunas administradas aquí en Long Beach en un 70% solo la semana pasada. Y también la semana pasada comenzamos a usar el Centro de Convenciones de Long Beach como un local de vacunación masiva, lo que nos permite vacunar a un mayor volumen de personas. En nuestro primer día pudimos poner la vacuna en los brazos de más de 1,800 personas. Nos asociamos con el Centro de Convenciones para poder vacunar a más personas por día. Sin embargo, en este momento, debido a la reducción en la asignación de vacunas, solo estamos haciendo de 500 a 600 personas por día. Incluso cuando estamos haciendo de 500 a 600 personas por día, como lo hemos hecho la semana pasada, el proceso es más rápido y más fluido, con menos impactos en el tráfico para los residentes, cuando vacunamos ahí. La razón por la cual solo estamos haciendo ahora de 500 a 600 vacunas o personas por día esta semana tiene mucho que ver con la disponibilidad de las vacunas. Tenemos la capacidad de poder ofrecer muchas más vacunas por día, pero estamos esperando que nos asignen más vacunas para poder hacerlo. Continuamos vacunando a los adultos mayores aquí en el Departamento de Salud de la ciudad de Long Beach y a través de una asociación con Long Beach Memorial Care Medical Center pudimos vacunar a más de 500 adultos mayores en lo que va de la semana. Memorial Care está usando alguna de sus dosis disponibles para vacunar a nuestra población de 65 años o más. Estamos muy agradecidos con nuestra asociación con Memorial Care. Este fue un programa piloto, pero planeamos seguir asociándonos con Memorial Care y esperamos asociarnos con otros proveedores de atención médica aquí en la ciudad para poder vacunar a los adultos mayores de nuestra ciudad que tienen un mayor riesgo de sufrir complicaciones por COVID-19 cuando la vacuna esté disponible. Reservamos las citas con adultos mayores que estaban en línea en la lista de espera. Por eso es tan importante poder inscribirse en VaxLB, VXLB. El sitio de web es longbeach.gov/VaxLB, VaxLB. Ahí podrá poner su información para poder conseguir una cita o que le informen cuando sea su turno. Las personas que no tienen acceso a Internet pueden llamar al área 562-570-INFO para obtener ayuda para registrarse. Otra vez es 562-570-INFO. Al sector de educación, ayer comenzamos a vacunar a los educadores. Comenzamos con el Distrito Escolar de Long Beach y esas vacunas continúan hoy. Para que los niños regresen a clases debemos proteger a los maestros. Mañana vamos a estar vacunando a aquellos que trabajan para el colegio de la ciudad aquí de Long Beach y el jueves vamos a cubrir la educación infantil, aquellos que trabajan en locales de educación infantil y las escuelas privadas. Ya que vamos recibiendo más vacunas, vamos a poder dar vacunas a locales adicionales en educación. En el sector de alimentos comenzamos a vacunar a los trabajadores la semana pasada y vacunaremos a más en el servicio de alimentos este viernes. Actualmente los empleadores programan las vacunas para los trabajadores de las tiendas de abarrotes y otros en el sector alimentario. La segunda dosis. En febrero, nuestra prioridad de vacunas va a cambiar a la segunda dosis. Recuerden que las personas que estén recibiendo la vacuna de COVID-19 necesitan 2 vacunas y Moderna y Pfizer tienen una efectividad del 95%, pero para alcanzar ese nivel de efectividad se necesitan esas 2 dosis. Tienen que tomar la segunda dosis en el mismo lugar o con el mismo proveedor donde recibió su primera dosis. El tiempo de espera entre la primera y segunda dosis para Pfizer es de 21 días y de Moderna es de al menos 28. Pero los estudios muestran que la tasa de efectividad del 95% aún se aplica si la segunda dosis llega dentro de por lo menos 6 semanas o 42 días. Entonces, aunque tienen inicialmente la segunda dosis para 21 para Pfizer y 28 para Moderna, los estudios están mostrando que pueden tomar hasta 42 días para tomar esas segundas dosis. Estamos trabajando intensamente con los gobiernos estatales y federales para asegurar que agarremos más vacunas para poder dar esa segunda dosis. A medida que ingrese una nueva vacuna, nuestra prioridad será esa, la segunda dosis para aquellos que ya han sido vacunados, incluyendo personales médicos y personas mayores de 65 años. Si todavía está esperando su primera dosis, esta noticia puede ser un poco decepcionante, pero les queremos asegurar que podemos obtener suficiente suministro y podremos continuar con las primeras dosis incluso mientras administramos esa ronda de segunda dosis para aquellos que ya recibieron la primera. Tenemos la capacidad absoluta para hacer esto, solo depende de lo que nos esté mandando el gobierno. Como todos saben, el gobernador cambió la orden de salud y se va a permitir ahora comer afuera de restaurantes y otros lugares también van a poder reabrir. Más sobre eso en un momento. Kelly Colopy, la directora de Salud y Servicios Humanos, nos acompañó hoy y dio una actualización sobre los números de COVID-19 aquí en nuestra ciudad. A la fecha, 46,833 residentes han dado positivos por COVID-19 en la ciudad. Esto es 10% de nuestros residentes en la ciudad de Long Beach que han dado positivo y sabemos que han tenido el virus. Hemos perdido 618 residentes de Long Beach a causa de COVID-19. 22 de esos 618 fueron durante este pasado fin de semana. El 14 de enero cruzamos la marca de las 500 muertes y este fin de semana que viene, y este fin de semana que acaba de pasar, cruzamos los 600. Ayer, como mencioné anteriormente, el Estado levantó la orden regional de permanecer en el hogar. Esto significa que los condados han regresado al sistema de nivel codificados por colores que permitirá la reapertura según el número de casos por cada 100,000 habitantes y la tasa de positividad entre las personas que se han sometido a pruebas por COVID-19. El levantamiento de la orden regional de estadía en el hogar se basa en la capacidad proyectada de las unidades de cuidados intensivos para las semanas fuera. En este momento, nuestra capacidad de las unidades de cuidados intensivos está en la región está ajustada a 0, pero el Estado proyecta que nuestra capacidad de cuidados intensivos regional aumentará a más de 33% para el 21 de febrero. Han cambiado el cálculo para poder incluir esas camas de emergencia con personal, lo que ofrece una imagen más positiva de la capacidad disponible en las unidades de cuidados intensivos. Esa proyección se basa en 4 variables. La primera es la capacidad de las unidades de cuidados intensivos estimada actual. La segunda es la transmisión comunitaria actual. Tercera, tasa de casos regionales actuales. Y por último, la proporción de casos ingresados en unidades de cuidados intensivos. Y recuerden que esto es todavía por región. La liberación al nivel morado no significa que estamos fuera de peligro durante esta pandemia. Las cifras siguen siendo mucho más altas que al principio de diciembre, pero están siendo mucho mejor que a principios de enero de este año. A principios de diciembre del 2020, nuestra tasa de casos era por 100,000 por cada 100,000 era de 39 y subió a un máximo de 162 por cada 100,000. Ahora hemos bajado a 86 por 100,000. Nuestra tasa de positividad fue del 5.9% el 1 de diciembre y alcanzó un máximo de 17% después de Acción de Gracias y ahora también con las vacaciones en diciembre. Y se alcanzó el máximo al 17% y ahorita hemos bajado a un 12%. Es un recordatorio que para salir del morado debemos tener menos de 7 casos por cada 100,000 y una tasa de positividad menor del 8%. Recuerden, estamos ahorita al 12%. Así es que tenemos mucho camino que recorrer para poder bajar. La primera imagen que se mostró muestra el número de casos nuevos notificados cada día. Tuvimos un aumento repentino el verano pasado y luego un aumento enorme después del Día de Acción de Gracias y durante las vacaciones. Afortunadamente, los casos diarios están comenzando a disminuir, muy poco, muy levemente, pero están disminuyendo. De un promedio de más de 700 casos por día, a principios de este mes, principios de enero, estamos a más de 700 casos por día y ahora estamos esta semana a 320 casos por día la semana pasada. Así es que sí estamos viendo mejoramiento. También estamos viendo una disminución en nuestras hospitalizaciones desde el 9 de enero. La cantidad de personas en el hospital sigue siendo muy alta, pero también está disminuyendo. Durante las últimas 2 semanas, las hospitalizaciones en la área de Long Beach han disminuido de 578 personas a 433 residentes aquí de Long Beach. Y los residentes que están, las hospitalizaciones de 578 a 433 son las personas hospitalizadas por total, que pueden incluir residentes de otras ciudades. Ahora, residentes de la ciudad de Long Beach han pasado de 365 a 310 personas en el hospital. La capacidad de la unidad de cuidados intensivos no ajustada ha aumentado recientemente del 9% al 11%. Hoy también daremos una orden de salud revisada que levantará las restricciones de la orden del Estado en la estadía del hogar regional. Eso significa que a partir de hoy algunos sectores permitidos bajo el nivel morado podrán operar aquí en Long Beach con modificaciones para poder frenar COVID-19. Esto incluye cena en persona al aire libre, sujeto a varias restricciones. Los requisitos incluirán separación de mesas de al menos 8 pies o aproximadamente 2,5 metros para mantener una separación constante de esos 2 metros entre las mesas. Se requiere mascarilla en todo momento, excepto cuando se coma o beba físicamente. Y es muy alentador que las personas solo cenen con miembros de su propio hogar. Servicios y cuidado personal e interiores como peluquerías y salones de uñas, salones de bronceadores, servicios de cuidado de la piel y cosmetología, arte corporal como tatuajes y terapia de masajes, con límites de capacidad para mantener 6 pies de distancia entre clientes y los que usan máscaras. Hoteles, moteles, hospedaje, unidades de alquiler compartidas y otras instalaciones similares para todo tipo de viajes, incluyendo el turismo y los viajes individuales. Los servicios limitados, según lo define el Estado, y operaciones al aire libre de museos, zoológicos y acuarios. Entonces, se va a hacer los cambios en la orden de salud aquí para la ciudad. También se permitirán reuniones limitadas de no más de 3 hogares, con reuniones permitidas solo al aire libre. La orden de salud que se publicará en línea más tarde hoy brindará más detalles y brindará orientación para las empresas a medida que reabran los servicios permitidos dentro de ese nivel morado. Todos estamos ansiosos por volver a algo parecido como una normalidad, y debido a que hemos podido frenar la propagación, es posible que se produzca una reapertura limitada de ciertos sectores. Aunque esto amplia la gama de opciones de los residentes, le pedimos que sea cuidadoso con sus decisiones para evitar otra vez más propagación de este virus. Por ejemplo, si usted decide ir a cenar 3 veces por semana, quizás ir a cortarse el cabello, hacerse las uñas, y va a reunirse con otras personas. Cada una de esas veces se está usted exponiendo a este virus y también exponiendo a otros. Así es que aunque técnicamente cada uno de estos es permitido ahora bajo la orden de salud, se pide que sea cuidadoso con lo que está haciendo. Esa semana de actividad puede exponer a otros y a usted también. Le pedimos que continúe limitando sus salidas e interacciones para ayudar a reducir el número de casos aquí en la región y en todo el estado. Esto también incluye las hospitalizaciones y muertes que hemos visto desafortunadamente. Solo el lunes pasado, el 18 de enero, el Distrito de Gestión de la Calidad del Aire de la Costa Sur levantó los límites para las cremaciones porque la acumulación de cadáveres se había convertido en su propia amenaza para la salud pública, por lo que no podemos bajar la guardia ahora que las cosas se sienten un poco mejor. Recuerde que llevar comida a casa de su favorito restaurante es aún más seguro que cenar en el local. Y cenar en el local con miembros de su familia es más seguro que cenar con miembros de otras familias, lo cual usted no sabe dónde han estado. Por favor, asegúrese que cuando haga esas actividades mantenga esa mascarilla puesta lo más posible. Sigamos trabajando juntos bajo esta apertura ampliada que permite el nivel morado para que podamos limitar la propagación de coronavirus o COVID-19. Cuantos más precavidos seamos ahora, más rápidamente podremos pasar a niveles menos restrictivos y abriremos de manera más amplia. Muchas gracias por acompañarnos. Eso es todo por hoy. If you've joined during our Spanish translation, please visit the city's Facebook page to view this press briefing from the beginning with Mayor Garcia and Kelly Colopy. We thank you for joining us.